the Real Health Podcast brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
So welcome everyone. I'm Dr. Ron Hunninghake, and I'm the Chief Medical Officer here at the Riordan Clinic. And we're pleased today to have as our guest Mr. Blake Benton. Blake, so nice to have you here. He is the head of the Strategic Initiative for Coming Together for a Cure, which is a nonprofit organization based here in Wichita, Kansas. And what we're going to be talking about is what they do. So welcome. And I want to mention that we also want to kind of weave in how your organization fits in with our history here at the Riordan Clinic. So, but first of all, tell me a little bit about this Coming Together for a Cure.
So initially it was the name of a fundraiser that my brother and our family came up with in 2008 after he started receiving mesenchymal stem cell therapy for Duchenne muscular dystrophy. And we discovered he was the first person in the world with Duchenne to be successfully treated with stem cells. And that made an enormous difference and changed the whole trajectory of our family and his health and our lives. And so over time we evolved, and now it's a nonprofit that has helped hundreds of families around the world and is helping spearhead clinical trials and providing countless resources to families that otherwise were unaware of or just hadn't afforded the opportunity.
Yeah. So to bring in the connection with the Riordan Clinic, tell us a little bit. Neil Riordan has been instrumental in the founding of your company, and his research and the research that he has done with mesenchymal stem cells, which are basically stem cells that will replicate and heal organs within the body. It'll repair organs within the body. And so Neil has been very much involved with that. But your version of how Neil has played a role in your company.
So my older brother, Ryan, when he was 3 years old, he was diagnosed with Duchenne muscular dystrophy, which is a terminal muscle wasting disease that affects roughly 300,000 people in the U.S. Most of the time, it's boys that are affected. And around 10 years old, boys lose the ability to walk. And typically around late teens to early 20s, the disease starts to become very critical and starts to look a lot like ALS. And then it's terminal, so everybody passes away by mid-20s. Thankfully, Dr. Riordan grew up down the street from my dad out here in East Wichita, and they went to high school together at East High. And as Neil Riordan, Dr. Hugh Riordan's son had done cancer research with his dad at the Riordan Clinic, and then that led him to stem cell research. And he had came across a study of somebody that received stem cells for Becker's muscular dystrophy, and they ended up then treating somebody with Becker's down at his clinic in Costa Rica, and the results were just tremendous. And so he called my dad and said, I think this is something that finally, might be able to be an option for Ryan. And it always stuck out to Neil because his daughter, his firstborn was born within about 2 weeks of Ryan. And so as Ryan grew and his daughter grew, their health just took, drastic turns. And so we're just extremely fortunate that he always kind of had us in the back of his mind as someone that he wanted to, hopefully be able to help someday. And so anyways, when he called my dad in 2008, Ryan had just that same day received the call from the local MDA office that one of his friends with the same disease had died. So think about the drastic comparisons of Ryan and our family's prayers were answered the same day that other kids and families were having the worst day of their lives. And so we made the most of it, and we prayed, and we realized we have no reason not to put our faith in this and Dr. Riordan. And so Ryan and my dad and his best friend went down to Costa Rica, and the cells allowed him to regain strength that he had never had before. Because when you and I, if we try to do a push-up, our muscles will feel sore. It's because they're breaking down. But for Duchenne muscular dystrophy, it's caused by a lack of a functional protein called dystrophin that's necessary to protect and maintain muscle. And so when he would try to do any sort of exercise, he'd never feel that, and his body just had constant atrophy. Well, after the first round of stem cells, we would exercise and he would feel sore. And all of a sudden he could pick his neck up and regain trunk strength in ways that maybe he had lost a year or two before. He all of a sudden had these motor functions regained. And so it's just phenomenal. And he was kind of a guinea pig because Neil was still discovering really the best ways to administer this. And so Ryan, he'd received 35 intramuscular injections and throughout his major muscle groups. And from there, they learned, how you need to then better practices to utilize IV instead of having to do direct intramuscular all the time. And so Ryan was kind of a pincushion and truly a pioneer for now so many other patients that have been able to benefit from this therapy.
Yeah. So Neil's father, Dr. Riordan, Hugh Riordan, was the founder of the Center for the Improvement of Human Functioning. So he was always about trying to help people improve their functioning. And certainly Neil, being the son and being an incredible scientist. I mean, Neil is probably one of the brightest minds that I know. And he also inherited that curiosity that his dad had that led him to start the Riordan Clinic. And what we do is we do various regenerative type things, because a lot of what people are experiencing these days are degenerative illnesses. Now, not necessarily genetic degenerative, but lifestyle degenerative, dietary factors, environmental toxins, poor sleep habits. All of these things indirectly lead to a kind of degeneration of the health of the body. So with your brother, he's your younger brother.
Ryan was my older brother. He was 7 years older than me.
Oh, you're the younger brother. Okay. Mm-hmm. So with him, genetically speaking, he was missing a factor that would allow him to make this one component necessary for muscle health.
Yeah. It is a spontaneous gene mutation. And thankfully, I didn't have it because it was spontaneous and it wasn't hereditary.
Yeah, yeah. And so with stem cells, basically stem cells are what the body uses to repair injuries within the body. And in this case, it's repairing a genetic, shall we say, injury. And it's having a dramatic effect. And it came about because of a willingness to look for answers, because sometimes people say, well, it's just too bad. It's genetic. There's nothing we can do. A lot of people sometimes say that with their chronic illnesses. They feel like they've gotten to the end of their road and no one's been able to help them. And so they kind of give up hope. But oftentimes with a look deeper to the underlying causes, there can be answers that are found. And so it takes that inquisitive spirit, but it also took your family's willingness to go out on a limb and see if this really worked for him. Now, you've actually gone on to make a movie about this whole story. Is that right?
Yeah. So, shortly after Ryan, we realized how it worked. He said, let's start a fundraiser and start giving back. And this was all in 2008. So this was when the social media was getting off the ground, and we started telling our story online and doing these annual fundraisers, and people started reaching out from all over the world. Well, over this time period, we started helping countless families understand proper education, get connected to trustworthy and reliable resources as they, pursued this type of therapy on their own. And we maintained relationships and started recording interviews and took a lot of video testimonials as people wanted to advocate for this, to show how it can be a new option for others. And so in about 2018, Ryan said, why don't we package all this together into a narrative story that can hopefully inspire and motivate and create the opportunity for others to take action. And so we spent countless hours over the last 5 years or so to put together this film that's now 80-minute feature documentary that we've screened and over in Rome, Italy at Film Festival there, as well as a film festival here in Wichita. And then we've got other festivals lined up throughout the rest of the year. But it's, so it includes stories of families that we've supported from Australia to the remote parts of Europe to big and small cities in the U.S. And it's people that took a risk, but it's calculated. They realized the standard of care wasn't working, and the line and the obstacles necessary to access current clinical trials in the U.S. are just unreasonable. And so they took matters in their own hands, as safe as possible, and now have amazing testimonials to share. And we're happy to help them, happy to help give them a platform to do that through.
One of the older Dr. Riordan's favorite saying was while they were saying it couldn't be done, someone did it. And so that's kind of what you guys are doing, along with Neil Riordan and this whole organization. And so what was the name of the movie? It's
called The Sunshine Dreamer. And, the name of that, it comes from, that was the name of my brother's band, his rock band.
Oh, yeah.
And so that's a theme that we want to make very clear, is that it's one thing to have the cells be able to help improve your health, but it's another thing to make the most of that. And that's what Ryan did every day. He had a drive to get out of bed because he was so passionate about music, and the community of friends that attracted to him gave him so much energy and zest to take on each day, despite his body still falling apart on him. And so, the name of his band is Sunshine Dreamers. They're a lot like a combination of the Beatles and Pink Floyd and some of today's like indie music. But, the movie really kind of weaves his story from childhood to very recent, just showcasing how you can make the most of life, especially if you can access this stem cell therapy that can allow you to fight back against your terminal chronic condition.
We see that a lot here at the Riordan Clinic. I've been here 34 years, and we see people who have been to 10, 20 other doctors, and they said basically there's nothing we can do, for severe chronic degenerative illnesses. And the idea we have is to look deeper, look at other underlying causes, keep your mind open, be open to the possibility that there is a way to find your health again. But sometimes you have to be a bit innovative and think outside the box in order to find it.
Well, it's really challenging, especially when the standard of care takes so long to evolve. And that's what's important. Like this film, we have a lot of subject matter experts, from people that work in the industry of life sciences to scientists and other researchers that speak about the efficacy and the safety of the cell-based therapies, but then also some people from the lobbyist and the regulatory side, a state senator, that can explain the regulatory frameworks that are currently prohibiting this therapy from becoming widely available, and then what can be done to ensure that we can make it safe and available for as many people as possible. So 'cause it's a really complex issue that can become very confusing, but we've done a very thoughtful job to make sure we're trying to spell everything out as clear as possible, because we know that it's irritating how many times people come to us over the past 15 years and said, this sounds too good to be true. It's like, well, we know what you mean. Now we're going to prove to you why it is true and what it takes to make it a true option for so many other families that are in dire need.
So one of the words that Dr. Riordan came up with, and I know Neil Riordan knows it well, and it sounds like this is a word that can be applied to your organization as well, is that Dr. Riordan referred, and was still today, we refer to our patients as co-learners. And so the whole co-learning word and concept is to bring that person who's needing help up and bring the person that's kind of offering help down a bit in order to understand the uniqueness of that individual. Because a lot of times in conventional medicine, there's a disease and here's a treatment, and there's another disease and here's the treatment. Whereas in illnesses that are not well taken care of by conventional standards, oftentimes the path to improving that person's functioning and that person's wellness is unique to that individual. Maybe it could be nutritional, maybe it could be hormonal. This is cellular. Who knows what other things? Psychological factors can play a role in a person getting well, because many people come to us, they've been told there's no hope. And if you give up hope, it's kind of hard to really find an answer at that point. So if you can help instill realistic hope in people based upon science, based upon research, based upon measurement, and based upon the willingness to search for that answer, that can be a very powerful road back to wellness. And so that's what you're doing, and I'm excited for your organization. And I hope people listening will look you up. How would they find you?
So the website is comingtogetherforacure.org, or the acronym ctfac.org. You can also find us through the same routes on all major social media: Facebook, Instagram, LinkedIn, YouTube. But I mean, you hit it on the head, because it's personalized, and precision medicine, thankfully, is now starting to become more of a standard. And we want to be a starting point for families that are tired of the status quo when they hear their initial diagnosis, or once they've tried every avenue and don't know where to turn. They need to realize that there are alternatives that need to stop being called alternatives.
Right.
And there's a simple way to learn about and how to access these. You just need a guide to help you get there.
Right.
And that's what we can be. And we're looking for more strategic partners that we can align their specialties to the communities that we serve and have 15 years of representing, because we know what their pain points are and we know what solutions exist, but they need help finding the bridge to make it accessible, and then giving them actionable steps to achieve those new resources.
Perfect. That really explains it well. And I think that is the journey for a lot of people who feel hopeless with any kind of chronic illness. Genetic ones are even the toughest, but now with this stem cell therapy, it looks like there's a ray of sunshine.
The sunshine dreamer is the perfect analogy, and we know that the light at the end of the tunnel is only getting bigger. And we're just thankful that everything's come really full circle right now. I mean, back at the place where it all started, thanks to Dr. Neil's dad here, Hugh, at the
Riordan.
clinic.
Yep.
And, there's enormous optimism and promise in what's happening with current trends in the market and new changes in the current administration. Thankfully, right, is looking very favorable upon what we are passionate and experienced with. And so, yeah, a lot of upside that we are thrilled to be able to be a part of.
Blake, thank you so much for being on our program and for all that you're doing to instill hope in so many people. So keep up the good work.
Thanks for having me.
You bet.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.